you ever feel like you can't breathe deeply? It's a problem that many people struggle with, but it does not have to be that way. There are solutions, and here to tell us about them is Dr. Wells from Columbia Breathe Free Sinus and Allergy Centers. Thank you for being here.
Thanks, Madeline. I'm excited to be here.
Yes, so let's get into the issue here. Why can people feel like they can't breathe deeply sometimes?
It's a very, very common problem. In fact, studies show that up to a third of people in the United States suffer from some degree of nasal airway obstruction. So it's a very common problem, a big problem, because it's frustrating for patients. Not being able to breathe through their nose, it's uncomfortable. When they try to exercise, they can't get that airflow that they need, and so it impairs their performance. The big problem often comes when they try to go to sleep. When they lay down, their nose really blocks up easily, and so that can lead to snoring and sleep apnea. Causes them to mouth breathe, and that causes a lot of problems with the health of the teeth. They can have a lot of bad breath, but really the thing that impacts them the most is they don't sleep well.
Right.
And so they're very tired, and so it affects their performance at work and at school. And the main causes of what we call nasal airway obstruction are really anatomic and inflammatory. So anatomically, there are structures inside the nose that if they're just too big, it blocks the airflow. Or if they're shaped just wrong a little bit, they can stick out into the airway and affect that airflow. And then those inflammatory things are just things that make the nose real swollen and stuffy inside, like chronic sinusitis, a lot of allergy issues, a lot of very common things people in this area deal with. And so that really causes them not to feel their best, and they're very frustrated. But when people come into Columbia Breathe Free, we're excited to help them.
Absolutely. So how can someone know if they struggle with this nasal airway obstruction? What are some of the symptoms?
Yeah, some of the key symptoms are just completely, most of the time, feeling blocked up and stuffy. A lot of times people will sniff a lot or blow their nose a lot, just trying to get a little extra room in there to get that air flowing, but it's usually very temporary, and so they're very much looking for ways to feel better and breathe better. One of the things that they can do to kind of test things at home is to put their fingers on each side of their nose. It's called the Cottle maneuver, and just gently pull out. And if that gives them a significant improvement in their airflow, they've probably got nasal airway obstruction.
Wow, okay.
Another little test they can do is to use a nasal spray, decongestant spray like Afrin or Equate. And if they spray that in their nose, and after 5 or 10 minutes, if their airflow is significantly better, they've probably got some type of airway obstruction.
Okay, so when someone comes into the clinic and you figure out that they have this issue, what are some of the solutions that you can offer them?
Yeah, so when they come to see us, and we love helping these folks because they're really frustrated, but when you help people breathe better,
so grateful.
They're really happy.
Yes.
They are really, really grateful. And so when they come in, we do a few simple things. We really check into their history for sinus or allergy, which has a big impact. We check out their nose with a little bitty camera. We just slide it just inside the nostril. It's very comfortable, but we can see their nasal cavity really well.
Wow.
And so we can evaluate those anatomic structures and see if they are too big or if they're misshapen. And then we get a simple scan or picture of the nose and sinus. So we can see what that airway looks like, if the sinuses are causing trouble. And then depending on what that shows, we can talk to them about a treatment plan. And all that happens on the patient's first visit.
Wow.
So it's very efficient, very convenient for the
Right.
patient. And so what we'll do is we'll talk to them about the options. So when we treat nasal airway obstruction, we certainly try medications first. You can have different kinds of sprays like steroid spray or antihistamine sprays. There are oral medications, decongestants and antihistamines. Most people have been on those by the time they get to me, and they're really only kind of just temporary.
Okay.
So we're looking to offer them more of a permanent or long-lasting solution. And what's great is we can offer very minimally invasive treatments in the office. And so it's just done under light sedation. Patients are very comfortable, it's very safe, but super effective. So we can reduce the size of those structures that are too big. We can reshape anything that's not shaped the right way, that's maybe bent and just needs to be straight. We can do all that in the office. If there's sinus issues, we can address that. We certainly treat their allergies. And so everything can be done very simply and efficiently in the office. Patients are back to work or school in just a few days.
Wow.
These treatments are very, because they're minimally invasive, we have very little bleeding. There's no packing to take out afterwards, so their nose isn't blocked up when they go home. There's no bruising or swelling. So very, very smooth, and patients are real happy with the results.
Oh, I'm sure. So if someone thinks they may have nasal airway obstruction and they want to get in touch, what is the best way?
The best way is to call our office at 803-233-7763, or also look us up online at www.columbiabreathefree.com.
Wonderful. Well, thank you so much for this helpful information, and I'm sure it will help somebody out there.
Thanks, Madeline.
Still ahead on Soda City Living, a one-stop shop for all your wedding planning needs is coming to the Midlands this weekend. We'll tell you all about it. Plus, it's Wednesday, so that means it's time for Woofs and Whiskers. Meet our pet of the week coming up.